morning, my name is Jennifer Vellin. I'm a nurse practitioner student at the University of Texas at El Paso, and today we're going to be doing a respiratory and cardiovascular assessment. First thing I'm going to note walking into the room is the general appearance of my patient. His work of breathing seems to be unlabored. I don't see any accessory muscle use. He has a regular rate and seems to be a symmetrical chest inspection. I'm going to first palpate. Skin's nice and warm. Is there any tenderness? Okay. Take a nice deep breath. Perfect, and relax. This is symmetrical expansion there. I'm going to do the same thing on the back, noting the anterior posterior diameter. And that's normal also. I don't see any evidence of COPD. The diameter there is normal, no barrel chest. I don't see any scarring, lesions, evidence of cardiac surgeries or pacemakers. So we're going to move on to percussing all the lung fields. Just going to feel a tap tap. I'm checking for any areas of dullness or consolidation, any hyperresonance. All right. Same thing in the back. And I don't appreciate any consolidation. All of the lung fields seem to be resonant. Next thing I'm going to do is check for the lung sound. So we're going to take a listen first. The diaphragm at the stethoscope. Going to take a normal breath. And relax. And breathe. And relax. Breathe. And relax. Breathe. And relax. Breathe. And relax. Breathe. Relax. Just here on the basis. Breathe. And relax. Breathe. And relax. Same thing on the back. Breathe. And relax. Breathe, relax, breathe, relax, breathe, relax, breathe, relax, breathe, relax, breathe, relax, breathe. I'm next going to check for any egophony or bronchophony. So every time I say now, I want you to repeat the words 99, and I'm going to listen back over the same places. Okay. Now.
99.
Now.
99. 99. 99. 99. 99. 99. 99.
Okay. And I should also note here, he doesn't have any bronchophony or egophony with his vocal transmission. The firmness is symmetrical for this patient, and he doesn't have any wheezing, crackles, or areas of diminished breath sounds. Everything's clear in all of his lung fields. So we can go ahead and move forward to the cardiovascular portion of his exam. I'm going to first note the capillary refill on both of your hands. There's no evidence of clubbing either. The capillary refill is less than 3 seconds. I'm going to check your radial pulses. It's a regular rate and rhythm, 2+, which is strong bilaterally. I'm going to also check on the lower extremities. I'm going to look for any evidence of dependent edema, and there is none. The skin's nice and pink. I don't see any discolorations. The dorsalis pedal pulses are 2+ and regular bilaterally. Capillary refill is less than 3 seconds. I'm going to have you just relax back onto the sofa so we have you at a good 30-degree angle for your cardiovascular exam. I'm going to move forward, looking at the neck. I don't see any tracheal deviation. There's no apparent jugular venous distension at this angle. Looking over to your left, sir, I'm going to first palpate for the carotid, and it's a regular rate and rhythm, 2+ on this side. I don't feel any thrills. Come back towards me. And same on the other side, 2+, regular rate and rhythm, no thrills. And then next listen for any bruits. Okay, back over to your left, please. Okay. No bruits there. I'm going to listen to the other side. Thank you. And no bruits there. Next thing I'm going to do is just estimate the jugular venous pressure. So I'm going to look over to your left one more time. I'm going to note the maximal oscillatory point and measure up from the sternal border. And we're right at about 2 centimeters, which is considered normal. Okay. You can relax back to the midline. Next, looking at the chest, I'm going to feel for any heaves, thrills. I'm going to feel for the point of maximal impulse here, which is where you'd expect right the mid-clavicular line at the intercostal space. Palpate over all of the heart valves. So it's going to be for any thrills. There are none. And next, listen to all the heart sounds. First with the diaphragm. We'll start with the aortic, sternal border, second on across the space. Pulmonic. Tricuspid. Erb's point. And then the mitral valve or the PMI. And the patient has a normal S1, S2. I don't hear any pathological splitting. I don't hear any S3, S4, no extra heart sounds. So just to be on the safe side, I'm going to have you turn onto your left side. I'm going to listen for any murmurs. This is where I would also feel if I had any issues finding the PMI on a larger patient. Over the same places with the bell of the stethoscope. And I don't appreciate any systolic or diastolic murmurs there. So last thing to do is I'm just going to check your blood pressure and your pulse. So I can actually have you just roll back onto your back, wherever's more comfortable for you. And since you have the regular rate and rhythm, I'm going to, in the interest of time, just listen at the apex for 15 seconds and multiply by 4. Okay, so it's going to be a heart rate of 60. And the blood pressure is 112/78, which would be considered a normal blood pressure. All right, do you have any questions for me?
No.
Thank you so much for your time.
Oh, thank you.